Hello everybody, I want to welcome you to this episode of our video podcast. Today's topic is pediatric dentistry, a pretty popular topic, lots of questions. I get questions all the time about kids and their teeth, and so today I'm real excited to have a specialist, a pediatric dentist specialist. Dr. Charlie Berteau is with us today, and he's going to help clarify and hopefully answer a lot of questions that we get. And for anybody who's out there has questions, I hope that we answer them. Dr. Berteau, I do have to mention, first off, you went to dental school at University of Florida, and you did your pediatric residency in Kentucky. And, about 2 months ago to the day was a huge thriller of a game, triple overtime in Florida. Florida did edge out and win. And, of course, my first question to you is, what did you think of that game? Were you on the edge of your seat? Were you torn? I mean, what's the status there?
Honestly, Ramsey, I was away from the TV. I found out after the fact. And like any game that goes into multiple overtimes, I wish I would have witnessed it regardless of where my allegiances may lie. But it certainly sounded like a nail biter. And thankfully, being a Florida resident, spending more time in Florida, maybe the right team won. I don't know. I have to say I think so. But I would have been happy either way, to be honest.
Okay, well, both teams are doing fine. So I wish we could talk about football all day, but we do have to talk about pediatric dentistry because I get oodles and oodles of questions about that. So let's start off with probably my single most asked question is how old do kids need to be before they start seeing a pediatric dentist or a dentist, or in your case, a pediatric dentist?
Well, they don't need to be any particular age, but our protocol or our guideline, if you will, is first visit by first birthday or soon after the first tooth erupts. That being said, if you have a little one that has unfortunately taken a fall, a spill, and we have some mouth injuries and they have no teeth in their mouth, that doesn't mean we won't see them. We will care for any child who has a oral health care need.
Cool. Okay. So, and I know historically, years ago it was considered 3 and 5 and all these different numbers, but 1 year is the bottom line number. 1 year or first tooth erupted, correct?
Soon after the first tooth comes in. Interestingly enough, that tooth is susceptible to decay the moment it comes into the mouth. If you try to colonize the bacteria that causes cavities in an edentulous or toothless mouth, if you will, you can't do it. But the moment there's even the slightest little tooth in the mouth, you will start to see colonization of strep mutans, which, as you and I both know, is the culprit in dental decay.
So I'm talking to the parents out there. I have a child. When is the soonest you could expect a child to start having their first tooth? What is that? Is it about a year, or is it just before?
We have to go by averages. I would say the average age that you'll see a child first erupt or cut their first baby tooth is between 8 and 10 months of age. That being said, we're all individuals. We all do things our own way, if you will. You have children that are born with teeth in the mouth. They have natal teeth. You have children who will cut teeth soon after birth, 3 months of age, 4 months of age, and you have just the opposite. You have children where you won't see the first tooth till they're into their teen months, 14, 15, 16 months of age and beyond. So those are obviously extremes, but on average, before the first birthday, usually 8 to 10 months of age, you'll start to see teeth start to make their way into the mouth.
Where are those teeth? Where are parents looking for those teeth?
Usually, and what we worry about as pediatric dentists more so than the age of the child is the sequence or the order in which these teeth come in. And the first teeth that are usually first seen are the lower central incisors, which are the lower 2 front teeth right in the center. Okay, so those are the first 2 that come in, and there's a total complement or a total set of 20 baby teeth, 10 on the top and 10 on the bottom. The last teeth to come in are the 2-year molars. They're called 2-year molars. They actually come in at about 29 months of age, plus or minus a couple months. And then let's just say, to make it easy, by age 3, we should have our full set of 20 baby teeth. Not a whole lot happens again until the child's approximately 6.5 years of age, and then we begin to lose our teeth in the same order that we got them in. So again, the first teeth that get wiggly are the very first 2 that came in as baby teeth, if you will.
Interesting. Okay.
Now, I will say the most important thing that I want parents to know is that baby teeth do serve a purpose. They do serve a function. It's amazing the number of times I have to explain why baby teeth are important, but parents should know that of those 20 baby teeth, only 8 of them are lost between the ages of 6 and 8.5 years of age. Okay, those are the 4 upper and the 4 lower front teeth.
Mm-hmm.
We still have 12 baby teeth that will hang around and be present and help our child function with regards to eating, chewing, speaking, growing, developing, holding the space for the adult teeth that will one day take the place of those last remaining baby teeth. Those teeth will be in the mouth till the child's about 12 years of age. So if decay becomes an issue, you want to address the decay. You don't want to wait until there's a toothache. Adult teeth hurt, baby teeth hurt just as much. So for those parents out there that have had toothaches, remember that's the same experience your child is going to go through, and it's going to affect the parent in more ways than one. Number one, your child's hurting, and if they're having a sleepless night, you're going to have a sleepless night too. So it's best to nip things in the bud when you know. I like to say little problems have little solutions. If you wait for it to be a big problem, sometimes the solution is also big and not quite so easy.
Yeah, like anything else, I think some preventive.
Correct.
So walk me through. So I'm a parent. I like those. I like the numbering because that really is a good understanding. Around 8, as early as 8 months, or more usually around a 1 year mark, and then by 3 you have all your baby teeth, and you have kind of a a hiatus where the tooth fairy hasn't come yet till about, you said 6, was it 3?
Correct.
So about till 6. So and then 6 till what are your tooth fairy years?
Well, the tooth fairy years are going to be, let's say, most active between 6 and 9. Okay. And then the tooth fairy kind of takes a nap for about 2 years. And then as we approach 10 and a half, 11 years of age, depending upon our gender, girls tend to do this a little earlier than boys. We will have roughly another 18, 24-month period where we start to lose those last 12 baby teeth. So typically, on average, by the time a child's 12 and a half, 13 at the latest years of age, tooth fairy has done her duty. She's collected all the baby teeth. She's made all the deposits she's going to make, if you will. And now we have our adult teeth, which, remember, we do not get a second chance with these teeth. We need to highly take care, preserve these teeth, because they're the only ones we get.
Sure. And out of all the questions, I surveyed all my patients the past few weeks knowing that I'm be interviewing today. And I'm thinking I'm going to get all sorts of questions about, cavities and this and that. And we have a list of things that I'm going to have to talk to you about. The number one asked question was, how is the tooth fairy? Everybody wants to know how's the tooth fairy. You obviously talk to her often. How is she doing?
Tooth fairy's alive and well. Quite busy these days, but she's doing very good.
Love it, love it. Okay, so now tell me a little bit about the first appointment. What do you, when a 1-year-old or 13-month, 14-month-old is coming to you, tell me as a parent what to expect. I know, I can tell you experience-wise, I have a family practice, a mostly adult practice. And I know as adults like to be in separate rooms. We don't like to have our mouths open in front of people. But your office is quite different, and I think it's built that way by design. I do know because I've been in there, and it's a sort of an open system, which I think for adults is probably a turn off. But I know there's a lot of, not to mention what the actual appointment is like. Like what should I expect as a parent
Sure.
bringing my kid to your office, as far as what you're doing clinically, and of course the office, and kind of how you manage that.
Okay. Well, there's a lot you asked me in
I'm sorry.
question. There's a lot there. So let's break it down into at that first 1-year visit, what's going on? What's the parent to expect? More often than not, when a parent comes in, I think their biggest fear is, how is my child going to behave, and what are they possibly going to be able to accomplish with my child? Well, I want to let all those young parents out there know that first visit is really more of an educational visit for the parent than it is anything truly involving the child. We will take a look inside the child's mouth. We're going to make sure that those teeth are doing what they're supposed to be doing, that we're brushing those teeth, and we do that by way of what's called a lap exam. Basically, the lap exam involves the parent and I sitting knee to knee. The child is sitting in the parent's lap facing the parent, and we lean the child back into my lap, where the head and shoulders are on my side, the rest of the child is on the parent's side. So essentially the parent and I make up the dental chair. And half the children get upset because they're scared, which means the mouth is open because they're crying. So I'm able to count the few little teeth that are in there. That's, again, the exam. When I do the counting, that's the exam. And a lot of children actually do quite well. We're able to manipulate the lips and the cheeks and have a good look inside the mouth and do a very thorough exam. It really lasts no more than 20 seconds. Soon after that, we sit up, and based upon my assessment, we start to discuss with parent how their hygiene is, where we need to improve, any concerns that I may have, we address those. There are a lot of, you and I know what the term hypoplasia means, but I use the term blemish so a parent understands. But sometimes, as you know, teeth are defective when they develop, and they can be spotty or uneven in appearance or almost a little rough or porous. So we reassure those parents what those lesions, if you will, are. And I like to call them a birthmark. It's just like I tell a parent, look, this is internal, it's in the tooth. It's not something that you can brush away or I can polish away. Literally considered a birthmark. We go over fluoride history. We go over when to start using fluoride toothpaste. So there's a whole slew of things that we're going to go over and address with the parent, as well as doing a very brief exam on the child. We don't actually begin examining the child or cleaning their teeth, if you will, in the dental chair until that child's at least 3 years of age. Now, that being said, we have 2-year-olds that want to be just like big brother and big sister, and they get upset when they get left behind. They want to come back into the treatment area and jump up in the chair. Yeah. And we have some 5, 6, 7-year-olds that are still a little unsure about it. So basically, everything is tailored and made custom to the patient and their concerns and their anxieties, and we do the best that we can with what we have to work with. Now, you alluded to the fact that my office is a little different in that we don't have private treatment areas, if you will. Right. Well, you're right. We have what's called an open bay concept. So the idea there is all the children are in one big room. They have their individual chairs. There is somewhat semi-privacy, but when you have a child that's coming back and they're feeling a little unsure and they're able to visualize other children being cared for and nobody's upset, nobody's crying, well, that's going to make them a little braver. That's going to make them a little bit more confident and feel good about what's going on and allow us to more simply perform our exams and our preventive treatments for the day, if you will. That being said, for my older patients or for those patients who aren't as quiet as we'd like them to be, we do have private treatment rooms where we can either help muffle out the sound so that we're not scaring the other children in the open bay areas, or if I have a teenager or someone who is undergoing something a little bit more sensitive where delicacy and privacy is necessitated, if you will, we do have a couple of private treatment rooms where we can go into and have those conversations, if you will.
Great. Yeah, I just remember seeing that, and I remember you teaching me about the psychology of it, and I think that's a good note. I always like that even the way the office is built and tailored is for kids. I mean, you go into your office, there's paintings on the wall, whatever, giraffes, and certainly not out of my office. I think it's nice that that's sort of tailored for children to know that there's that rationale, which makes sense.
We definitely have fun with it.
Yeah. So, okay, a little bit of home discussions for parents. I want to mention a big topic was fluoride. You mentioned it, and I want you to give me your opinion on fluoride as far as at home, and that's going to curtail into, sorry, I'm asking you so many loaded questions, but we got a lot. Everybody wants to know about their kids, and so this is a hot topic for everybody, is how do parents clean their kids' teeth, when they have less teeth? Do they use, I know there's different tools, like a little finger cot you can buy. When do you use a toothbrush? When do you start using fluoride? And then I'll address the thumb sucking after that. But so tell us your thoughts or recommendations for the parent watching this video about fluoride, yes or no. Certainly it's sort of a debatable hot topic a lot of times. And then how to clean their kids' teeth at home.
Okay. Fluoride is a naturally occurring mineral in the environment, so we're all exposed to it. It's just a matter of, are we being exposed to the optimal amount? Most of Central Florida has community fluoridated water. If you live in certain parts of Central Florida, let's say Apopka, certain parts of East Orange County, city of Castleberry, they do not have fluoride in their drinking water. So those children may need to be supplemented. Okay, certainly if you're out in rural areas and you are well-based, so a well water system, you likely have trace amounts of fluoride, so those children are going to need to be supplemented as well. As you know, the purpose of fluoride is to help strengthen the teeth. It makes the tooth stronger and less susceptible to the acid breakdown that is the cavity attack on the tooth. Okay, so we know that a cavity is basically a bacterial infection, and the presence of bacteria creates an acidic environment that softens and breaks down the tooth enamel. It's very much like if you were to put muriatic acid on any surface, the first thing it's going to do, it's going to bleach or whiten that surface. So we see the white spot lesions on teeth, so you and I know what those are. Now, not all white spots, just so we don't alarm the parents, not all white spots are cavities. But beyond that, eventually the enamel starts to get rough, kind of chalky, and it breaks down, and we get a cavity. So exposing the teeth to fluoride helps strengthen the weaker areas, so the white spots that are pre-cavity lesions, and the healthy enamel makes it stronger so that we don't see those white spot lesions. Okay, fluoride can be applied in two different ways. You have topical applications, which come by way of toothpaste or rinses. We don't really advocate rinses for children under the age of 6 because we're concerned that they may swallow that, and that's really not healthy for them. And generally, I don't like to have parents expose children to fluoride toothpaste prior to 2 years of age. Okay, and that has to do with the concern of fluorosis. That being said, if I have an 18-month or a 20-month-old child that's in the office and they rate out at high risk, I'm definitely going to have fluoride toothpaste be employed during the home routine.
Sure.
The key is the quantity of toothpaste that's put on the toothbrush is really the key. You can limit how much toothpaste is swallowed if you limit how much toothpaste you put on the brush. Okay, but fluoride is important, and I'm a big advocate of it. I understand that not everybody is in agreement with what fluoride is and what fluoride does, but you and I know that in dentistry, fluoride is our magic touch. It's our golden rule, and I can tell you when I see kids that have loads of cavities, it's usually the child whose parent is against fluoride, and they're not buying the fluoride toothpaste, they're not drinking the fluoridated community water, and that is precisely the child that needs to be on fluoride, unfortunately.
Sure.
And that's true 99 times out of 100.
Sure, yeah, I do get that. So, and okay, so let's talk about tooth grinding. I know a lot of parents tell me my kids are grinding. They call me up frantically. My kid's grinding their teeth at night.
Yeah.
Tell me about that. I know you probably get this a lot as well.
I generally hear this mainly during the summer months when families are vacationing. Everybody's in one hotel room together for cost-saving purposes, if you will, and it's usually the little one that's been fast asleep for a couple of hours. They're deep into their sleep, and now you hear the grinding of the teeth. It's ongoing. I want to reassure all parents this is a normal process that all of our children go through. Some are more active grinders than others, but the grinding has to do with the development of their TMJ, or temporal mandibular joint. So basically the jaw joint, the lower jaw articulates with the base of our skull. And as that continues to grow and develop, your child will go through periods where at nighttime they're going to grind their teeth, and it's perfectly normal. It rarely presents any type of problem to our dentition, if you will, from a wearing down standpoint. Some children will wear on those baby teeth, but I have in 20 years only encountered 2 instances where I have, let's say, a 11, 12-year-old that has actually put wear facets or wear patterns on their adult teeth. I just don't see it. Despite whatever level of wear I may see on baby teeth, I don't really see it on the adult teeth. So it's not a concern.
Sure. So as long as you're monitoring the kid, as obviously you do, it's usually going to go away for the most part. So
Correct.
Tell me another habit that we see is thumb sucking, pacifier. That's another one. Is there an age limit? How do you manage that? When should a parent watching this video say, boy, my kid has this thumb sucking habit? What are the limitations there?
Sure. We term that non-nutritive sucking, okay? So in other words, it's a habit that's not providing any nutrition to us.
Right.
So what it does soothe the child. It does calm the child, especially if they're nervous or anxious for whatever reason. It stems from the rooting reflex or sucking reflex from when they're babies.
Mm-hmm.
It usually is very self-limiting. A lot of children will stop before age 1. Some children will continue beyond that. I usually encourage a parent that if attached to their thumb, well, of course, they're all attached to their thumb, but if they seem to have a propensity to favor the thumb or finger from a sucking standpoint, I would encourage them to use or to push a pacifier, because ultimately we as parents are in control of the pacifier. We are not in control of the thumb or the finger. Okay?
Sure.
So if there's a pacifier that's involved, you know, mom and dad can certainly limit how often that pacifier is used. Ultimately, it has to do with the intensity and the duration of the habit. So if you have a child that very intensely sucks on their, whether it's a pacifier, a finger, or a thumb, and they do it frequently throughout the day, that's when we're most likely to see changes in our tooth position or actually in the shape of our jaw that supports our teeth. Remember, at this age, the bone is very soft, it's very plastic. So it doesn't take a whole lot of force to warp that bone that supports the tooth. So ultimately, we would like for children to be done with their thumb sucking habits or their non-nutritive sucking habits by 2.5, 3 years of age. Mm-hmm. If it continues beyond that, typically they're going to stop on their own by 5, 6 years of age, certainly by the time they get into grade school, if you will. Mm-hmm. And if it continues at that point, then that's when I tend to get involved. Now this is me, this is my practice. I really wait on a habit appliance until that child's about 6.5, 7 years of age. If basically they've lost their upper baby teeth, the adult teeth are coming in, and we still have a sucking habit, at that point we're going to bring out the big gun. And the big gun is just basically, it's a passive appliance that just changes the way the mouth feels when the thumb is in there. It makes the child less interested because they're not deriving the same satisfaction out of it, and they stop their sucking usually within 4 or 5 days. Sure. However, we keep the appliance in place for a year. We really want to snuff it out.
Wow, okay? That's great. I love it, Dr. Berteau. I really appreciate it. I just want to just a couple last just some highlights. So if you're a parent out there watching this video, between 8 months, or I'm sorry, first tooth or about 1 year, get your child to a pediatric dentist to have them evaluated. By about 3, all your child's baby teeth should be in. Certainly, and I know this too, but I'm just, you definitely want to take care of these baby teeth because they're going to be in there for a while, up to 12, you said, right? Or
correct.
Up to 12. Correct. So lots of time in there to cause problems, teeth shift.
Absolutely.
You lose teeth. Now the teeth are like books in a bookshelf. They start tipping and flailing, and now you don't have the space for the adult teeth. I mean, I think we both know that there's a lot of problems with not take care of baby teeth. You do put fillings in baby teeth. You do want to take care of them. Keep your kid out of pain. Keep your kid out of a toothache all night long. And as you said, I think I would agree, most pediatric dentists are going to agree with fluoride, and we all see the benefits of it. Some people have some strong preferences against it, and certainly that's everybody's will with their child. And I really appreciate it. Everybody who's watching this video, I hope you found it informative. Please, you're certainly welcome to post your comments, questions. We'll all try to get to them at the bottom of this YouTube channel. We'll try to reply as best we can. And Dr. Berteau, I really appreciate your time. I think everybody's going to find this real helpful.
Dr. Matar, always fun.
Thank you.